one.
Hi, I'm Wendy Griffith, and I'm a nurse practitioner student at Auburn University. I'd like to teach you today about a drug class known as the tetracyclines. Tetracyclines are a group of broad-spectrum antibiotics. The drugs in this group are tetracycline, oxytetracycline, democlocycline, minocycline, tigecycline, and doxycycline. This group of antibiotics, the tetracyclines, are effective in treating gram-positive organisms such as Staph aureus, MRSA, S. pneumoniae, and also they treat gram-negative organisms, intracellular organisms. With other drugs, they're effective against H. pylori, rickettsia, and spirochetes. Tetracyclines are commonly prescribed to treat acne. They can be used as a malaria prophylaxis, traveler's diarrhea. They're effective against Rocky Mountain spotted fever, the drug of choice for Lyme disease. They're also effective in treating sexually transmitted infections as well as GU infections. The pharmacodynamics of tetracyclines are that they affect the 30S ribosome of the organism. The tetracyclines will bind to that through protein synthesis and actually prevent amino acids from combining with the organism to replicate. The pharmacokinetics of tetracyclines, they are absorbed in the stomach, the duodenum, and the small intestine. Their distribution is highly lipid soluble. They can be transmitted into the pleural fluid, the sputum, fluids of the eye, the prostate. They also do cross placental membranes and cross into the breast milk. They are metabolized in the liver. They are excreted in the renal and biliary system. Doxycycline and minocycline are excreted in the bile and the feces. The pharmacotherapeutics of tetracyclines, they should be prescribed cautiously in people that have renal and liver impairment. They also should not be prescribed for lactating women or pregnant women. Doxycycline is a category D for pregnancy. All the other tetracyclines are in pregnancy category X. They should not be prescribed for children less than 8 because they can affect the skeletal growth of children, and also they can cause permanent yellowish to brown staining of the teeth. Also, teach patients if they are prescribed a tetracycline that they should never take any outdated tetracycline. Even in the expired state, it can become nephrotoxic. Adverse drug reactions with tetracyclines have to do mostly with the effects that it has on the GI system. Tetracyclines can irritate the gastrointestinal tract and cause nausea, vomiting, and anorexia. Teach patients who are on a tetracycline to take the medication with a full glass of water and remain sitting up for at least 30 minutes after taking the medication. Tetracyclines can also cause some lightheadedness and some vertigo, and they cause photosensitivity. Patients need to avoid sunlight as much as possible and also tanning beds. For the drug interactions of tetracyclines, for patients taking antacids, magnesium containing laxatives, iron salts, and zincs, the patient should separate the administration of those by at least 2 hours from a tetracycline. Tetracyclines also interact with Coumadin and increase the INR rate, and they can affect the effectiveness of oral contraceptives. Rational drug selection for doxycycline is available in tablets and suspensions. Doxycycline is the drug that's most often prescribed in primary care. Minocycline is the drug of choice for treatment of acne. Make sure to tell the patient to keep the container closed and in a dark place. Finish all their medication and teach them about the spread of the infection. For the main takeaways, I would like to leave you with some helpers that are going to help me go through this. I want you to remember that tetracyclines should never be prescribed to pregnant or lactating women. Tetracyclines can also cause phototoxicity, so you want to remember to teach patients to apply proper sun protection and stay out of the sunlight if they're taking a tetracycline. My final takeaway is to remember that a side effect of tetracyclines is that they can cause permanent teeth staining in children. So no tetracycline for any children under the age of 8.